Hospital bills are getting out of control. Just this past year, a Colorado woman named Brittany Tesso got her son a speech therapy evaluation. Afterwards, she got a bill from the Colorado hospital for $676.86. That's a lot of money for 2 hours worth of work, but fine, doctors are expensive. However, just 2 weeks later, she got another bill in the mail, $847.35. It was called a facility fee. But here's the thing, Brittany and her son didn't actually go into a facility at any point. The entire speech evaluation was done over a Zoom call. Surprise bill increases like this are happening all across the United States, and many Americans have no idea that they're paying for facility fees. Facility fees that don't even go to paying doctors. In this video, we're gonna look at why this and other price hikes are showing up on American hospital bills, the US price paradox that makes it even possible, and the silent partner stealthily driving up prices for procedures that really haven't changed at all. Let's dive in. To understand what, or rather who is causing these mystery price increases, you should know that the US healthcare system doesn't follow normal economic rules. To keep this short, in a regular market, competition and upfront pricing keep costs down. For example, if two stores sell the same TV, shoppers can compare prices instantly and the cheaper one's usually gonna win. But in US healthcare, the patient rarely knows the price up front, and the person paying the bill is usually an insurance company anyways. This creates what I'd call a blind market, where costs are set in secret deals between insurance companies and hospitals, and you have no idea. And the paradox or contradiction is that most hospitals explain their bills through a fee-for-service model. So a doctor's office or hospital gets paid for every test, visit, vaccination, or medicine prescribed. Basically, the more a doctor does, the more a hospital gets paid. It's like if an employee got paid for every email that they sent. They'd just be saying, just circling back on this 50 times a day just to pad their paycheck. But for a doctor's office to actually get paid, this fee-for-service model has turned into a bureaucratic nightmare. A nightmare where, for many doctors, the harder a doctor works, the more the hospital makes, while the doctor just gets buried in more paperwork. So why is this happening? Since literally 1776, when the US became a nation, American doctors have, by and large, been their own bosses. They ran their clinics like any other local small business or solo enterprise, and that continued until relatively recently. In 2012, over 60% of doctors worked at a doctor's office that they owned. But since then, the math has actually flipped. For the first time in history, more physicians in the US are employees than owners. In 2024, only 42.2% of doctors were their own bosses. Why this sudden change? Well, many doctors say this happened for 3 reasons. 70.8% of doctors say they sold because they couldn't get fair payment rates from giant insurance companies on their own. Remember, US healthcare prices are a negotiation. So if you're not big or have a lot of power, you're not gonna have a lot of leverage. New laws required upgrades to document and track your health. Electronic health record systems cost over $30,000 up front plus monthly fees. Put simply, the fee-for-service model drowned doctors in so much paperwork, the same paperwork that allows them to get paid, that many of them ended up selling to those who hiked up the prices. The silent partner is actually a couple of massive corporate players, and 2 of these players have been on a decades-long buying spree, and your increased medical bills is one of the ways that they've helped pay for that spree. The number of private equity deals to buy out doctor practices skyrocketed 600% between 2012 and 2021. And the data shows us that these firms buy clinics to monetize them, which, of course, private equity buys a business and then they try to sell it for more money. But the study found that private equity acquisitions, as they're called, led to price increases in 8 out of 10 medical specialties. For doctor's visits to a cancer doctor, prices increased 16.4%, digestive system doctor 14%, eye doctor 8.7%. And at the same time that this has been happening, massive hospital chains have been buying up community hospitals and local doctors' offices. In nearly half of all US metropolitan areas, just 1 or 2 hospital systems now control the entire market for inpatient care, which is just where you stay at a hospital overnight. I said the US healthcare system doesn't follow normal economic rules, and this has just made it worse. In a normal market, if a store charges too much, you go to the competitor. But in modern American healthcare, the competitor is going extinct. But let's bring this back to Brittany Tesso and her $847 facility fee Zoom call. Basically, once a giant hospital system buys a small clinic, like the speech clinic Brittany's son was observed by, they can reclassify that speech clinic as part of the actual hospital. This allows them to slap on a massive facility fee to cover hospital overhead. Stuff like emergency rooms, 24/7 staffing, all that kind of stuff. This is the case even if you go to the same exact doctor's clinic that you've always gone to, or in Brittany's case, her and her son are just sitting in their living room on a Zoom call. And here's one more example to illustrate how private equity or hospital ownership raises costs. At an independent doctor's office, removing a full arm cast averages $43. The same procedure at a hospital-owned clinic costs $298, 7 times as much. So what does all this mean for you? Well, before your next checkup or maybe procedure, do a little background check on your doctor's office. On their website, if you see hospital affiliated or a department of, insert big hospital name here, call them up and ask them point blank if they charge a facility fee. Hunting for a physician-owned or truly independent practice is definitely going to be a little bit more work, but it may be one of the only ways to opt out of the corporate price hike here. If you found this video interesting and you'd like to see more like it in the future, please consider subscribing for more. This is Tyler Dutchover. Thanks for watching.